Assalamu alaikum. Hi, I am Dr. Asad Saleem. Today I am discussing about crucial topic on heat stroke. It is a serious medical condition. It occurs when the body's temperature regulation fails. This can happen during intense physical activity or prolonged exposure to high temperatures. Heat stroke is a life-threatening emergency that requires immediate medical attention. Our bodies have an internal thermostat that keeps our temperature around 98.6 degrees Fahrenheit. When we get too hot, our bodies sweat to cool down, but sometimes sweating isn't enough. If we're exposed to high temperatures for too long, our bodies can overheat. When the body overheats, it can damage the brain, heart, kidneys, and muscles. This damage can be temporary or permanent. In severe cases, heat stroke can be fatal. It's important to be aware of the dangers of heat stroke, especially during the summer months. By taking some simple precautions, you can help prevent heat stroke and stay safe in the heat. Heat stroke is a medical emergency. It's important to know the signs and symptoms so you can get help right away. One of the most noticeable signs of heat stroke is a very high body temperature, often above 104 degrees Fahrenheit. Along with the high temperature, a person experiencing heat stroke may have hot, red, or dry skin. Other symptoms include a rapid pulse, headache, dizziness, nausea, confusion, and even seizures. In severe cases, a person may lose consciousness. Recognizing these warning signs and seeking immediate medical attention is crucial for a positive outcome. Diagnosing heat stroke involves a combination of physical examination and laboratory tests. Doctors will check the patient's body temperature using a rectal thermometer, which provides the most accurate reading. In addition, blood tests can help assess the severity of the condition. These tests may reveal elevated levels of electrolytes, kidney function markers, and liver enzymes, indicating organ damage. The prognosis for heat stroke depends on several factors, including the severity of the condition, how quickly treatment is received, and the patient's overall health. Early detection and prompt treatment are crucial for improving outcomes. Treating heat stroke requires immediate action to lower the body temperature. The first step is to call 911 or your local emergency number. While waiting for medical professionals, move the person to a cool, shaded area and remove any unnecessary clothing. Cooling measures can include applying cool water to the skin, fanning the person, and placing ice packs on the armpits, groin, and neck. Preventing heat stroke involves taking precautions, especially during hot weather. Stay hydrated by drinking plenty of fluids, preferably water or sports drinks containing electrolytes. Wear loose-fitting, light-colored clothing and avoid strenuous activities during the hottest parts of the day. Remember, prevention is key when it comes to heat stroke. For more life-saving medical insights, please like, share, comment, and subscribe to my channel at Asad Saleem 1414. Let's all stay safe and healthy this summer.